Hi, my name is Anna Larson. I am a prosthetist at Coyote Prosthetics and Orthotics. Today I'm going to talk about the wear and tear of a pin lock suspension prosthetic. So I have a couple different examples here that I'll go over first. There are many different types of locks. Today we're using the lock of our sister company, and that is Coyote Design. So I'll talk about that a little bit. This is the air lock, which is just a push button release. So that's how you get the pin out, and then you don't have to push anything, it'll just click in. And this is the easy off lock. With this one, you can just click the pin in, and then to release it, you open it, and you can use both hands to take the prosthetic off. However, you want to make sure that you close the lock when you're done so that it's ready to go next time and the pin is ready to engage. So first we are going to start with how to put your liner on. So most times you will have a prosthetic liner, and that's what this is called. And they come in all different colors, there are different types. But generally what you're going to want to do is turn this inside out. You want to turn this all the way inside out. So here, you can see there's just a little bit on the end. You want to make sure that you get completely to the end. And then you're going to want to take this part, put it right up against the distal part of your residual limb, or else the kind of the end of your leg. And then you put it right onto your skin, and then you can roll this up. And you can kind of use both hands and just roll it on there. And you want to make sure that you don't have any wrinkles. Sometimes in the back of your knee specifically, you'll get a wrinkle like that. You're going to want to make sure you don't have any of that. And then you don't want to leave this doubled over. You want to make sure that you roll it all the way up. And then when you take it off, it's going to be the same thing. You just fold over the edge, and then just use your hands to kind of roll it down. What you don't want to do is pull on the edge. That's going to wear your liner out a lot faster. Once you have your liner on, and this one has the pin already attached to the liner, so this is how your prosthetic is going to stay on. You want to take your leg, and you can just kind of push it down into the pin lock. And then if you listen really close, you can hear the pin clicking in. So that's what that sounds like. And then to release it, we'll do that. Now with this, sometimes the pin will get in the wrong spot. So if you look in there, there's a hole in the bottom that the pin goes in. Sometimes what happens is if you put this on and the pin is rotated a little bit, if it's too far forward, too far off to either side, or too far down, you'll have trouble engaging the pin. So that might be something that you want to play with. You want this to be as straight as possible. And then when you put your prosthetic on, sometimes it can help if you put your leg into it, and then if you push on just the heel part and leave the toe up, that can help give you a little bit more leverage. And you'll want to hear generally clicks that are one at a time to begin with, like that. And then you want to make sure you have 3 clicks. Once you have 3 clicks, you're okay to stand up and walk on it. The pin is not fully engaged in the lock at that point. However, that's safe enough to get started. And then as you walk around a little bit more, sometimes slowly you'll hear, 1 click at a time, take a couple more steps. You can get another click. And the reason that I am talking about this is because when you put your prosthetic on, if you hear this, and they all go in all at once, that's a sign that your prosthetic is too big at that time. And how we resolve that is that you're going to add a prosthetic sock. So this is a prosthetic sock. And this is used just to take up some space in the prosthetic, because generally your volume is going to fluctuate day to day, possibly during the day is pretty common for your prosthetic to be tighter in the morning, and then as you're walking around on it, more and more fluid gets pushed out, and that'll cause your limb to reduce in volume, and that's when you're going to add a sock. A lot of people find that in the early afternoon they need to add a prosthetic sock. So how you put these on is, if you already have your liner on, this goes over top of the liner. So we'll just put it on. This one I think has a hole in it for the pin. Yes, it does, so that is good. You just pull that on like a sock on your foot. You're going to want to make sure that the sock is right up against your liner. You don't want it to be like this, because if the sock gets stuck in your pin lock, you might have a very hard time getting your socket off, and that's no fun at all. So make sure that you have it pulled all the way up. And they come in different thicknesses. This is a 3-ply sock. It says right on there, some of them have different colors on the edges. Generally the ones that we use are lightweight, 3-ply, 5-ply, and sometimes 6-ply. And the higher the number, the thicker the sock. So they're pretty easy to deal with that way. You can just wash these like any sock, washer, dryer, or you can hand wash them, let them hang dry. That's kind of your choice. If you're a new amputee, you're probably going to need to use socks more often. What usually happens in new amputees is that they have a lot of swelling, fluid, and things like that, and then once they start wearing the prosthetic, they get some compression, and the shape of their limb will reduce in volume. Also, there will be some muscle atrophy that occurs there, also reducing the volume of your limb. So sometimes new amputees can reduce in volume quite quickly. And then one big question is, how do I know when to add a prosthetic sock? And there are probably a lot of different right answers. The most common is that you're going to feel pressure on the bottom of your limb. And the reason for that is that we're not holding you, let's see, up at the top here anymore. Because you got smaller, you drop into the socket, and you feel that pressure on the bottom. And so in the beginning, you should feel maybe a tiny bit of pressure on the bottom. We want you to have contact with the bottom so that you have this kind of pressure on the bottom. We don't want you to have that kind of pressure on the bottom. Kind of the general rule, that's not always the case. So if you have any issues or problems, as always, definitely talk to your care provider. So on the liner, how you're going to wash these, and you want to do this every day. This will help keep you from getting any kind of infections or anything. So you want to turn it inside out again. And you can just, some people do this in the shower, some people do this in the sink. Turn it inside out. You're going to want to wash it with a mild detergent, rinse it off really well. We don't want you to have any soap left on here to irritate your skin. When you're done, you can kind of dab it dry, but you want to make sure you're not using a fuzzy towel or something, because this is a really sticky material and all those little fuzzy pieces will stick to it. If you want to let it air dry, that's fine too, but after you wash it, make sure that you always turn it back so that it's right side in. If you leave it inside out, that can kind of cause degradation of the material down here, and it'll just wear out your liners faster. In most cases, you'll get more than one liner. So you'll have two, and the reason for that is you want to rotate them. And that just kind of helps you to be able to wash them every day, let them dry properly, and helps protect your skin a little bit more. So this is a prosthetic foot. There are many, many different types of prosthetic feet. And generally you'll have an inner part of your foot, which is this. And then you'll have a foot shell over top of it. So this is an example of that. So the foot part is actually inside of the foot shell. And one thing you need to be really careful with as an amputee is that you want to make sure that you don't switch your shoes to a different heel height. You can switch your shoes, but make sure that they're the same heel height. And the reason for that is that these feet are made to wear with a shoe. And if you have too high of a heel height, it'll change the whole angle of your leg and how you're walking. And same thing if the angle is too low of your shoe, it'll change everything above it. So you want to just be really careful that you're not changing your heel height with your shoe, because that can throw everything off a little bit. Sometimes in that foot shell, you can get sand, dirt, things like that, just depending on where you are, what your activity level is. If you have any issues with that, sometimes you can just turn the leg over and kind of tap it out. But if you need a more thorough cleaning, definitely bring it into your prosthetist. They can take the foot shell off, take the foot apart, and clean whatever needs to be cleaned. If you get sand into your foot shell and it's in there for a long period of time, that can act like a sandpaper and actually wear down your prosthetic foot faster, that inside part. So you want to be careful about that. As a general rule, you don't want to get your prosthetic wet. That'll make it wear faster, deteriorate faster. There are special prosthetics that are made just for that, but as a general rule, you don't want to do that. If you do get it wet, dry it off right away. And as a big rule, any of your microprocessor parts, which are some of your knees and ankles, most likely you'll know if you have one, you really want to keep those away from water as a general rule. See, the last thing I think we're going to go over is the positioning of your leg when you're sleeping or sitting. If you're an above the knee amputee or transfemoral amputee, that just means it was amputated through the femur, which is this upper bone in your leg. You want to make sure that when you lay down, you don't have a pillow underneath your leg that's causing your hip to be flexed. And the reason for that is sometimes you can get a hip flexion contracture, is what it's called, and that can make it a lot more difficult to walk, and that just means that you can't straighten your hip all the way back. And same thing with a below the knee amputee or transtibial amputee, which means through the tibia, which is the lower leg bone. You don't want to sleep with a pillow or lay with a pillow under your knee for an extended period of time, because the same thing can happen. You can get to where you can't straighten your knee all the way out, which they call a knee flexion contracture. Same thing with the hip. You can get so you can't straighten your hip all the way out. So that's just a preventative measure that's pretty important. These are all general guidelines. If you have been instructed otherwise by your doctor, care provider, prosthetist, or orthotist, those rules should override anything in this video. Generally, people don't have problems, but sometimes there can be mechanical failures. So if you hear a strange noise, if you see any cracks or anything like that, contact your prosthetic provider right away. And I can show you on here. This is an example of a foot that cracked a little bit, and you can see that in there. And she knew that right away, and she contacted us immediately so that we could repair or replace it for her. To clean your prosthetic, if you get dirt on top of it or dust, anything like that, you can take it and just wipe it down with a damp cloth. And you don't want to use too much water, just so that it's nice and damp. You don't want to be dripping into any of the components or anything like that. If you have any questions, definitely feel free to contact your care provider.